Hello my dear friends, I am Dr. Rajesh Shetty, Professor Head, Department of Prosthodontics, Yenepoya Dental College, Mangalore. I am here to talk about finish lines. Many a times there is a confusion among the postgraduates and the undergraduates about what is the type of finish lines that we need to give to our restorations. Let's say a PFM or a laminate or an all ceramic crown. So today I am giving this lecture so as to put some water into your doubts and clear certain doubts which are there in your mind. So by today's lecture I am planning to give a definition for the standard definition for the finish lines. What is a margin, what is a finish line, what is the requirements of a finish line, location of a finish line, types of finish line selection based on a restorative material. So now why is finish line important? Now finish line refers to a process, or tooth preparation refers to a process of removal of a diseased and or a healthy enamel and cementum to shape a tooth to receive a restoration, be it a laminate, be it a PFM crown, be it an inlay onlay or a all ceramic restoration. Now tooth preparation forms the basis of a fixed prosthodontic treatment and forms the foundation for a successful fixed restoration. A restoration may be deemed successful only if the margins are in close adaptation with the finish line of the preparation. As the popular statement of Divan states, the perpetual preservation of what remains rather than the meticulous replacement of what is lost is still a gold standard. So the tooth preparation should be conservative yet satisfy the biological, mechanical and the aesthetic need of the patient. So what does the latest GPT-10 and all the other various the textbooks of prosthodontics say about the definition of finish line? Now according to GPT-10, the finish line is a junction of a prepared and unprepared tooth structure with the margin of a restoration. Now in simple words, if we have to say what is a finish line, I would put it as a peripheral extension of a prepared tooth or the area where there is forms a seat for your restoration. That is forms a vertical stop for your restoration so that it prevents the vertical impingement of your crown. So it forms a seat. So that's in a very simple words to put it about a finish line. Now we need to understand what is the difference between a margin and a finish line. Now there are main definitions. If you go, a margin is the outer edge of a crown or inlay or an onlay or any other type of restorations, whereas the finish line is the junction of the prepared and the unprepared tooth structure with a margin of restoration. Now what are the requirements of a finish line? Why do we say that finish line is important? Now the basic requirements is, first thing is, it should be smooth, it should be even and distinct. When I say distinct, it should be clearly visible and it should be not rough, it should not have ledges on your preparation. The preparation should follow the gingival contour, should avoid unsupported enamel at the cavo surface line angle. I will come to it later. Should be easy to identify in impression or an optical scan. It should conserve the existing tooth structure and it should provide sufficient bulk for the restorative material. So these are some of the general requirements for a finish line. Now why do we say that the finish line needs to be important is, the marginal adaptation improves when the finish line is smooth and even. Now what do you mean by marginal adaptation? That is the gap between the margins of your crown and your finish line. Lesser it is, the better it is. Simply because what happens is, if there is a marginal gap, there is a dissolution of cement taking place and there are chances of recurrent caries, and then there could be other periodontal issues. So what happens is, the longevity of your restoration comes down. So if this marginal gap is least, then the chances for the longevity of your restoration goes up. So for that, the finish line needs to be very smooth and even. So, like I said, the restorative margin and its true structure is a potential site for recurrent caries because of dissolution of the cement in the margin. Now, various studies have said that, some studies have been done where they have said that 120 mu microns is a clinically acceptable marginal gap. But and some studies have also said that up to below 100 is also a clinically acceptable marginal gap. But what is happening is nowadays the manufacturing process of your ceramic is improved from conventional. We have moved on to CAD/CAM. From CAD/CAM you have your addition and you have your subtraction, where now we say that the addition is a better mode wherein you have less marginal gap. So depending upon the material. Now usually gap, when we say marginal gap for a metal restoration, let's say a molar, we can expect it nowadays to be around 50 to 60 microns, and CAD/CAM ceramic, or there can be a difference between your CAD/CAM layered ceramic and a monolith. So nowadays this gap is going down from 120 microns. We are expecting it to come to around 20 microns as such. So when the manufacturing process is being better to reduce this gap, so it is necessary as the clinician to be skilled in creating an even and a smooth finish line, so that this micro gap reduces further. And again, for this, along with the marginal adaptation, preservation of the prudentium is also very important. So that will come to where do we need to place our finish line. Now, as you all know, the finish lines, the location, it can be either supragingival, it can be either equigingival, or it can be either subgingival, depending upon the condition. So this part of discussion, I will not be talking about the indications of supra, equi and subgingival finish lines. But as we all know, supragingival is the best finish line which is possible, so that it's self-cleansing and it can take care of itself. So that it should be placed supragingival, a millimeter away from the free gingival margin, and equigingival margin is at the level of the marginal gingiva, and subgingival is placed usually 1 to 1.5. Usually in healthy adults, 1 to 1.8 mm of free gingival margin space is there. So your subgingival margin preparation needs to be around 1 to 1.5 into that space, and you need to take care that you do not violate the epithelial attachment, because if you go beyond this 1.5, although 1.8 is an average value for a healthy adult, if you go beyond 2 millimeters, you impinge on the epithelial attachment, thereby violating the biologic width, leading to periodontal issues. So that's with the subgingival margins. But yeah, there are certain cases like in the case of an anterior teeth, if you are giving a PFM crown to mask the metal, you need to give a little, you need to place the restoration subgingival so as to mask the metal collar. Now, finish lines again can be classified, based on their configuration, that is the shape. So you have what is the knife edge, then you have what is the chamfer, and you have shoulder. And there are modifications of each of these configurations. We will come to it in a short while. There is another classification according to based on the width of the finish line. Now, you have knife or feather edge or chisel edge, wherein the width of the prepared finish line is roughly around 0.3 to 0.5 mm. And for a chamfer finish line, it is around 0.5 to 1 mm, and anything between 1.5 to 8 mm, you get a shoulder finish line. Now, let's go on to the first type of finish line. So you have what is called as a knife or a slight modification, you call it as a feather edge or you call it as a chisel edge margin. Now, it is the most conservative of all the tooth matter. So yes, if you say conservative, it fills that bracket. So, but what are the disadvantages? It does not provide a distinct margin. The width of this margin is usually between 0.3 to 0.5 mm. So what are the instruments used to get these margins? Actually, you have the long tapered needle diamond point. So you can use this burr. the indications would be for an all metal restoration, you have for molar abutments which are tilted, where aesthetics is not a concern but conservation of tooth structure is vital, and in young adults with high pulp chambers, and for laminates. Now we all need to remember that for laminates bonding is very important. Bonding is possible only if there is enamel. So you need to reduce a tooth around 0.5 to 0.8 mm where enamel is present. As you all know, when the tooth tapers down cervically from the incisal region, the thickness of the enamel reduces, and the thickness of enamel is least in the cervical area. So if the thickness is around 0.5 to around 0.9 to maximum 1 mm, then you can use this type of configuration to give a laminate preparation. So what is the advantages of basically of this type of preparation? Yeah, conservative of tooth structure, but there are more disadvantages in using this type of finish line than in others when comparing it to chamfer or a shoulder. So usually most of the times this type of finish line is not used, because what happens is if you want to decide to give a PFM crown, what happens is the thickness of the margin is not good. It is just 0.3 to 0.5 mm. So what happens is sometimes while trying to add ceramic, there can be chances of over contouring the tooth, there can be chances of overextension of the metal. If you make it too thin, then opaqueness of your ceramic will be seen. So ideally this is not used nowadays, but certain cases, yes, like in laminates, or if you have an young adult, or if you want a long term temporaries with metal restorations on a non-aesthetic zone, then this is a type of finish line that you can think of. So the next disadvantages, like I said, again over contoured, margin is not distinct, hence there is a difficulty is encountered in recording the margins in impression. So when the impression doesn't come out well, if it is not recorded, in the cast also it will not be recorded well. So it affects dye preparation, wax pattern preparation also. Okay. Next comes chamfer. Now this is the preferred finish line for full veneer metal restoration and on palatal and lingual margins of PFM restorations. Areas where you would like to give a metal collar, that's the areas. So palatal and the lingual margins of PFM restorations. So these are indicated, this finish line is indicated for these type of restorations. So what is the instrument used? It's a round end taper, diamond point, or a torpedo diamond point. Again the finish line width is 0.5 to 1 mm. Now this finish line forms a obtuse angle with the caver surface margin. Okay, it's also called as a slip joint. Actually when we see here, it is an obtuse angle. Usually we have a shoulder, it's a straight line, so it's a 90 degree. This is more than, it's an obtuse angle, and that's why it is called, other name is also called as a slip joint. So how do you prepare, or how do you go around getting this finish line? So chamfer margin is created by sinking only half of the burr used to prepare the tooth to prevent lipping of enamel. Now lipping of enamel is a general problem which occurs when you use round and tapered burr, because since we use only half end of the burr, so you need to see this lipping of enamel doesn't occur. Why? Means in case lipping occurs, it tends to chip, and when it tends to chip, there are chances on a long run, there are chances of secondary caries happening on the tooth. So you need to see that lipping doesn't occur. So what are the advantages? Again, conservative of tooth structure, less stress concentration. The margin is an excellent choice for full metal restorations as it allows varnishability of the metal in the margin, enhancing marginal adaptation. So what are the disadvantages? It does not provide enough restorative bulk to support ceramic. Now as you all know, for ceramic you require at least a space of around 1.5 to 8 mm thickness, that is roughly around 0.3 to 0.5 thickness coping metal coping, and the remaining thickness is of the layered ceramic. So this doesn't provide the thickness, as the finish line thickness is just around 1 mm. So what happens is, if you go on to do a PFM crown, what happens is either the coping becomes too thin. So if it becomes too thin, the structural durability of the restoration is lost, it tends to break, or the ceramic layering what you do, there will be an opaqueness of your ceramic layer because you cannot put adequate thickness of the layered ceramic. So the opaqueness of your dentine or of your opaca which you use to mask the metal shines through this, and it will be more opaque. So it will not be a good finish line wherein aesthetics is concerned. So again, it causes enamel lipping. So it is not of a great concern. The enamel lipping, you can always round it off if you have a lip. So modification of your chamfer is a heavy or a deep chamfer. Now the only difference is it's got a rounded internal angle. Now you need to see what's the difference. What is the difference in the burr? Now we said that in the case of a chamfer, we use half the width of the burr. Okay. Now when you are using a heavy chamfer, you need to take a size which is slightly larger than the one used to make your regular chamfer. So that's the only difference. So here what happens is the internal line angle becomes a little bit more obtuse, and you have little bit more tooth reduction, but less than that of a shoulder. So the radius of curvature equals to the depth of the axial rotation. If you see here, this is a 90 degree. So the width of the finish line is roughly around 1 to 1.5 millimeter. So the indications would be for PFM restorations and importantly zirconia restorations. So we talk about there is a difference when to go around and give an all ceramic crown, because there are different types of all ceramic crowns. You have a zirconia all ceramic crowns, you have glass based all ceramic crowns. So the difference is, in all ceramic you need bulk. So when you require bulk, you need to give more width on the finish line. So, and whereas in zirconia crowns, the coping, which is again made up of zirconia, is as good as a metal coping. So you have enough strength on that, so the width required is a little less. So you can go in for a deep chamfer. So that's the reason I have specifically written about zirconia restorations. You can give a heavy or a deep chamfer. So instruments used, it's a rounded diamond point used to create a deep or heavy chamfer finish line. The tip of the point forms the margin, while the shank provides the axial reduction. So what are the advantages? So it provides sufficient bulk, because the tooth reduction is again around 1.4 to 1.8 mm. So it gives a good thickness for your ceramic, layered ceramic. So it provides sufficient bulk, so it's more aesthetic. Rounded internal angle prevents stress concentration. So it improves it prevents your teeth from breaking off, and it provides structural durability to your restoration. It forms a distinct margin and can be recorded easily in an impression or in a scan. So again, what are the disadvantages? There is a risk of enamel lipping, which you need to round off. The next type of finish line is a shoulder. So we would like what you call it as a classic shoulder. So finish line with a 90 degree KO surface, margin forming a butt joint. So this forms 90 degree, that's why it is called as a butt joint. Whereas in the case of chamfer, we call it as a slip joint because the angle is obtuse. Classic shoulder requires more reduction of tooth structure to form a distinct margin. Yes, the margin here is the best, it can be detected the best, but then we are removing more tooth structure. So what does it do? What are the advantages is, because the margin is very distinct, it's a wide ledge, it provides resistance to your compressive occlusal forces. Indication that it is a finish line of choice for all ceramic restorations, especially glass based ceramics and PFM restorations, wherein you require more bulk of the material. for it to be aesthetic. Otherwise, it would be a little opaque and it would not suit the aesthetic needs of the patient. So what is the instrument used? We use a flat end taper diamond. The width of the margin is again 1.5 to 1.8 mm. So advantages: the sufficient bulk of the restoration provide good aesthetics. Disadvantages: excessive tooth preparation, sharp internal walls, we said butt joint 90 degrees, sharp internal line angles create an area of stress concentration and may lead to fracture of tooth structure if you are not too careful about it. So some modifications were done on the shoulder finish line. They were the radial shoulder, the sloping shoulder and shoulder with bevel. So we have already done with the classic shoulder. We will talk about the radial shoulder. Now it's a modification of the classic shoulder finish line. The 90-degree KO surface margin to provide sufficient material bulk is also given. But the difference here is that although that was 90 degrees, this is the KO surface margin which we are talking about, it's around 90, but here, which was also 90 degrees in the case of a classic shoulder, here it is rounded. So because you have an internal line angle that is rounded, what happens is it improves the structural of your restoration, the stability of your restoration. So the instruments used is done similar to a classic shoulder, that's the use of a flat and tapered diamond. And how do you round off the internal line angle? So you can use a modified bin angle chisel or you can use an end cutting diamond point. Okay, now I'll just come on to later. You have different types of cutting instruments when you are doing these finish lines. So you can have twist drills, you can have diamond points, you can have stones, then you can have tungsten carbide burrs. Now most preferred cutting instrument is a diamond point, but we need to realize that whenever you have a diamond point, there are chances of creating roughness on your finish line or on your tooth surface. So that is where the tungsten carbide points come into being. Now tungsten carbide burrs have got, if you see, different flutes. Lesser the number of flutes, the cutting efficiency of that burr or of that point increases. More number of flutes, the finishing of that preparation enhances. So you have, in case of tungsten carbide points, you have different flutes. You know, if you have flutes of around 4, 8, 10, it's the cutting efficiency increases. Whereas if it goes about 20, 40, the finishing of that preparation enhances. So whenever you feel you have a rough edge, you can use a similar sized tungsten carbide burr and finish or smoothen the preparation and the finish line. So radial shoulder, again PFM and all ceramic restorations. Advantage: reduced stress concentration because of the rounded internal line angle. Now disadvantage is more tooth preparation when you compare to a chamfer margin. The next modification is the shoulder with bevel. So it's a modification again of a classic shoulder finish line. It's a shoulder with a bevel on the external edge. If you see here, the first half, it is the shoulder, and this edge which you see, the outer edge or the external edge, that is the bevel that you give. So usually you give a 45-degree bevel which is added to the external margin of your shoulder preparation. So where are the indications? It's usually preferred in gingival box preparations, onlays, and where a metal collar restoration is planned for a posterior PFM restoration. So what are the advantages with shoulder with bevel? The advantages is the beveled margin improves the burnishability of the metal and also prevents enamel lipping because of the bevel. So beveling of margin also improves the resistance and retention form. Now what is the disadvantage? If you see here, we have a shoulder and then on top, if you see, there is a bevel. Now usually this bevel, it's hidden in the free gingival margin area so that the metal is not seen. Okay. So what is the disadvantages? There is a risk of violating the biologic width as beveling places the cavus surface margin apically closer to the epithelial attachment. So you need to see this red structure, what you see here, you are not supposed to impinge on that. The moment you impinge on that, your longevity of the restoration is lost. Okay? So you need to see that it is short of it, that is the distance of around 1 to 1.5 millimeter. It should be within this free gingival space. Now question now, to bevel or not to bevel. Okay? So the angle of the bevel is critical to ensure proper seating and margin adaptation of the restoration. So more acute the bevel is, more the marginal discrepancy. So we have certain 90 degrees, we have 15 degrees, we have 5 degrees, we have 45 degrees, 30 degrees. So if you see more acute, less than 90 degrees, more the marginal discrepancy. And if it is most preferred angle is 45 degrees. So what happens at 45 degrees, the fit of your margin of the crown to the finish line is better, the marginal gap reduces. So when the marginal gap reduces, your influx of cement dissolution doesn't happen. So next modification is again the sloped shoulder. Okay, it's a modification of the classic shoulder where the margin is sloped to 120 degrees instead of the usual 90 degrees. The indication again you give it in PFM restorations. Okay, so again, what are the advantages of a sloped shoulder? The sloped shoulder prevents the formation of unsupported enamel. Again, it's a 120 degree finish line. The slope margin hides the restorative margin beneath the gingival tissue and hence can provide acceptable aesthetics. Now here is some of the studies which has been done comparing finish lines, that is a classic shoulder and a deep chamfer on the marginal fit of zirconia and glass ceramic crowns milled using CAD/CAM. Like I said, the evolution in the manufacturing has reduced this marginal gap. So what does that study conclude? That the deep chamfer margin had lesser marginal discrepancy when compared to shoulder margins, especially in the zirconia group. There was another study which is done to evaluate and compare the marginal integrity, that is the gap, adaptability, what you call it, gap of shoulder with bevel and sloping shoulder margin in a PFM crown. The study concluded that shoulder with bevel finish line had better marginal fit when compared to sloping shoulder, and it also provided biologic and aesthetic advantage when compared to a sloped shoulder. So if I have to summarize what are the different types of finish lines, what are the diamond points used and where and what situations we have to use. So I would just put it as knife edge or chisel edge, 0.3 to 0.5 mm width of your finish line. You can use a torpedo diamond point or you can use a long tapered needle diamond. So where do you use it? Okay, you can use it for laminates or full metal crowns. Although it is very difficult to identify those finish lines in an impression, but okay, you can still use it in case you are able to identify it in a case of a laminate finish line, you can still use it. The next comes chamfer, that is rounded tapered diamond point burr, that's the tip width is 0.5 mm. Again, you can use a round and tapered diamond point or a torpedo diamond point. So where do you use it? In case of full metal crowns and parietal margins of PFM facing crowns and laminates. Laminates, that would be the best finish line in case you are comparing it with a knife edge. Okay. Deep chamfer, that's the next. Again 1 to 1.5 mm width, round end tapered diamond point is used. And what are the crowns that you can do with that? We can have a PFM crowns and all ceramic crowns, zirconia, that is zirconia based all ceramic crowns. So then you have what is called as a classic shoulder, that is 1.5 to 1.8 mm width, Flattened taper diamond point, the per tip width is 0.8 mm. Again used in all ceramic crowns, especially glass based ceramics, PFM crowns. Radial shoulder, flat and tapered diamond point, and then you use a biangle chisel or your end cutting diamond points you can use to round off the internal line angle. So again, where do you use it? In all ceramic crowns, posterior or PFM crowns. Shoulder with bevel, that's the next finish line. Beveling is used by using a torpedo diamond points. So where it is used, inlays, onlays, proximal box preparations, facial margin of PFM crowns. And then the slope shoulder, that is flat and tapered diamond point, is used to provide a 120-degree shoulder margin. Again, facial margins of PFM restorations. Now these are some of the finish lines that you can use depending upon the type of restoration you get, and it can change whether you would like to give subgingival, whether you would give equi, or whether you want to give it depends upon the case that you get. So it is very important for us to know what is the type of finish line that we need to give to the patient depending upon what is the type of material, restorative material you are trying to give. So if it's an aesthetic crown like in all ceramic crowns, if in the anterior teeth, all the types of finish lines that we need to give, that is very important. What we choose is very important, because it should not be a problem for the laboratory procedures if you give them a knife edge finish line and ask him to do a full contoured all ceramic crown or a PFM crown. So we need to do, as clinicians, it is our job to provide our technicians with the best possible finish line so that it is very distinct for him, and we can then expect him to do a good job in return. So with this, I hope I have cleared some of the doubts about the use of finish lines in relation to the types of restorations that we plan to give our patients.